Imagine waking up one day to find a mysterious itch, an uncomfortable burning, or maybe an unusual bump. Your mind starts racing, questions pop up. Could I have an STI? How long has it been there? Do I need a test? Every year, millions face this exact worry, yet so many of us are left wondering what to do, how soon to act, and what exactly to expect. Chapter 1: Understanding STIs and STDs. First, let's clarify some terms. Sexually transmitted infections, STIs, also known as sexually transmitted diseases, STDs, are infections that spread primarily through sexual contact. They are surprisingly common, affecting people of all ages, backgrounds, and lifestyles. But here's the challenge: many STIs don't show symptoms right away. And when they do, the symptoms often seem like other minor health issues. That's why testing is so critical. Testing is like turning on a light in a dark room. It lets you see what's there, even if you don't feel it. Chapter 2: Symptoms and Common Signs of STIs. Let's talk symptoms. Not all STIs cause symptoms, but if they do, some general ones to look for include: genital itching or burning, pain during intercourse or when you urinate, new or unusual discharge, bumps, sores, or growths on or around the genitals, and even foul odors. Some infections like herpes can show symptoms within just a few days, while others, like HPV or HIV, might not show anything for months, or even years. This is why relying on symptoms alone isn't a safe bet. You might not feel sick, but that doesn't mean everything's clear. Chapter 3: The Importance of Testing. Testing can be daunting, but it's essential. Think of testing as an early warning system. Early detection can help catch infections before they lead to serious health issues, like infertility, cancer, or even life-threatening diseases. Getting tested after potential exposure isn't just about protecting yourself, it's about looking out for those you care about, too. And don't assume you're in the clear just because you haven't had symptoms or because you only have one partner. Many STIs stay dormant, meaning they can hide in your body for years without a hint. Chapter 4: How soon to get tested. So, let's get down to the specifics. When should you get tested? Here's a breakdown of common STIs and their testing timelines. 1. HIV. Tests range in how long it takes to detect the virus. Nucleic acid tests are the fastest, working within 10-33 days. Antigen/antibody tests are reliable between 18 and 45 days. Antibody tests take the longest, needing 23-90 days for a clear result. 2. Chlamydia. Symptoms can show up in a week, and tests are typically accurate within 1-2 weeks of exposure. It's best to get tested early, especially if you notice any discomfort or unusual discharge. 3. Gonorrhea. Symptoms generally appear within 1 day to 2 weeks, and tests are usually reliable within 5 days to 2 weeks. If you test negative shortly after exposure but feel something is off, consider retesting within a couple of weeks. 4. Herpes. This one's tricky. Symptoms often appear within 2 to 12 days, but a blood test may be needed if you don't have visible sores. Most tests detect herpes by 4 months after exposure. 5. HPV. This virus often flies under the radar, especially in females. A pap smear is the go-to test, and it can detect HPV about 3 weeks to a few months after exposure. 6. Hepatitis B and C. These infections have longer windows. Hepatitis B can show up on tests within 3-6 weeks, while hepatitis C often requires up to 6 months for a reliable result. A blood test is the best approach here. 7. Trichomoniasis. This infection often shows symptoms within 5-28 days, with testing generally accurate within a week to a month. 8. Syphilis. Syphilis starts with a painless sore and is detectable in blood tests within 1-2 weeks after the sore appears, making the total window about 4 weeks. For peace of mind, many doctors recommend a follow-up test around 3 months after exposure. Knowing when to test is empowering. It lets you stop wondering and start knowing. Chapter 5. Living with the uncertainty. Why testing regularly is key. Because STIs can stay dormant, it's easy to spread them unknowingly. That's why the CDC suggests that all sexually active adults test annually, especially if they have new or multiple partners. Don't wait for symptoms to show. Regular testing is an act of self-care that prevents unnecessary health risks down the line. Chapter 6. How testing benefits you and your partners. Testing doesn't just protect your health, it protects your partners, too. Some STIs, like chlamydia and gonorrhea, can be treated if caught early, while others, such as HIV or herpes, are incurable but manageable. Here are a few ways testing helps. Early treatment. Catching STIs early makes treatment easier, and in some cases, it can even reverse damage. Prevents spread. If you know your status, you can protect others from exposure. Peace of mind. Knowledge is power. Knowing your status can free you from worry. Healthier future. Left untreated, STIs can cause severe issues, from pelvic inflammatory disease to increased cancer risk. Chapter 7. Overcoming the fear of testing. What if you suspect you have an STI, but you're scared? That fear is normal. But remember, ignoring an infection doesn't make it go away, it only gives it more time to spread and potentially worsen. Clinics and health centers are there to help. No matter how you feel, taking charge of your health is one of the best decisions you can make. Chapter 8. FAQs about STIs. Let's wrap up with some common questions. 1. What are some common STI symptoms? Think genital discharge, rashes, itching, warts, and pain when urinating. But remember, many STIs don't show symptoms, so regular testing is crucial. 2. Can all STIs be cured? Not all. Bacterial infections like chlamydia and gonorrhea are curable, but viral infections like HIV, HPV, herpes, and hepatitis B aren't. They can be managed, though, and hepatitis B has a vaccine. 3. How can I tell if I have an STI? Testing is the only way to know for sure. Symptoms are clues, but not everyone has them. If you've recently had unprotected sex or a new partner, get tested. 4. What if I'm scared to get tested? It's okay to feel scared, but remember, you're not alone. Health professionals are there to support you through the process. Think of testing as a step toward a healthier, worry-free future. Closing thoughts. At the end of the day, it's all about empowerment. By testing, you're taking charge of your health, protecting yourself and those you care about, and staying ahead of any potential health concerns. Testing may not be a one-time thing, but making it a regular part of your routine can help ensure a future of healthier relationships and peace of mind. Take that first step today, and encourage others to do the same. Your health matters, and you deserve to know your status with confidence.